Good afternoon. Welcome to our weekly update in the Department of Behavioral Health. It remains National Hispanic Heritage Month, and I hope you're seeing those emails come out reminding you of some individuals in our community and across the state who really represent that group. All right, and again, a reminder about our Speak Out event, which is this Friday, October 9th from 3 to 4:30. And that is a live conversation on youth LGBTQ, mental health, and wellness with Juan Acosta and Kylene Hashimoto as our moderator. All right, and on to our COVID information. We're now just under 36 million cases across the United States and over 1 million deaths, 1,052,000. And we have 7.5 million cases in the United States and 211,000 deaths. In California, we're up to 831,000 plus cases and over 16,000 deaths. And in Fresno County, we now have over 29,000 cases. We actually have over 399 deaths. I believe on the county's website, it's a little over 400, but this is the state's website. And so we continue to see that case count is going up a bit. The trend that we're really watching closely right now is hospitalizations. It is not part of the state's parameter anymore, but it's a good indicator to us of the prevalence of illness in our community. And so last week, I had reported out that we had 80 individuals hospitalized, and that actually got down to 73, but now we're over 100 again. On this slide, you'll see 100 individuals hospitalized, but that's with only 8 of the 9 hospitals reporting. Yesterday, when all 9 reported, it was about 107 in the hospital and 18 in the ICU. So we're a little concerned that number's up. And the other thing that we're concerned about on our next slide is that the watch list. So remember, we have the new tiers, and we had been in the purple tier. And last week and the week before, we entered into the red tier. And so we were really trending in the right direction. You can see on the screen that we had a positivity rate that had been hovering around a little under 5%. That was actually in the orange tier. And the new cases per day of 6.3 to 6.2. And a reminder that that's 63 cases or so a day. Well, we're now back in the purple tier on the number of cases per day, and we're still in the red tier in the positivity rate, but trending in the wrong direction. We're heading back up again. I really can't emphasize enough how much we all want to stay out of the purple tier. I was at the board meeting yesterday, and a lot of frustration in that room to contemplate that the hard work that got us into the red tier might not keep us out of the purple tier, that we are drifting back in that direction. And so you'll see a lot of activity over the next couple of weeks, reminding people to wear their masks, reminding people to follow the precautions. We did all see our president this last week acquire COVID, and we've seen really the White House become a hot spot for COVID. And one of the things I wanted to raise with that is that it really shows you that the daily testing, because we know that they're doing daily testing, isn't really anything more than an indicator of that moment, whether or not you have enough COVID in your system to have a positive test. And so you can be positive one day or negative one day and positive the next. And that exposure could have happened 2, 3, 4, 10 days prior to that. So the daily testing is good, but we really all have to be aware that even if you tested daily, you still can get COVID, and when you get it, you've likely been potentially spreading it even beyond that time before you tested positive. So really something that we're watching closely, paying attention to. I did hear a report that came out in the last day or two from our Secretary Mark Galley, who's our Health and Human Services Secretary for the state, And he mentioned that a new report had come out showing that right now there's not a lot of evidence of spread due to the opening of schools, so where schools have opened, but it might be a little too early. So that's something we'll watch really closely. One of the things that a lot of activity has been going on in the last few weeks is preparing schools to reopen. You have to be in the red tier for a couple of weeks, and then 2 weeks after that you can open schools. That gives schools a time to prepare, and there's a lot of preparations going on. So also a lot of nervousness that all this preparation might be for naught if we stay in the purple tier. So we really have to work collectively together as a community to stay out of the purple tier. Learn to live with COVID, follow the precautions. All right, on to the Creek Fire. The Creek Fire is winding down as far as the fire response. All of the areas that were impacted by the Creek Fire that have a population with houses and such have been reopened in one way, shape, or form. And so largely the area is open for individuals to go back. There is still a lot of unsafe fire activity going on. So even on a property where the fire has been gone for several days, there can be embers, deep roots of trees burning, that type of thing, as well as the hazardous waste associated with the property. So while the re-entry has happened and people can go back to the area somewhat with some restrictions, there's still a lot of work being done to create safety. The other thing that we're waiting for is a disaster declaration by the president. Once the president provides that disaster declaration, which we're hoping to get by the end of the week, then that will open up some funding through FEMA for individuals impacted by the Creek Fire as well as some other fires in the state. So we're really hoping that that happens. We continue to have town halls. We had one last Thursday at Sierra High, the county did, and another Facebook town hall happened on Tuesday night, and there'll be another one. This slide says Thursday, October 7th. It's actually Thursday, October 8th, my error. Again at Sierra High School for individuals who have been impacted by the Creek Fire and want to learn more from the different agencies who are collaborating to respond to the Creek Fire. I again wanted to just mention disaster fatigue. I know we've talked about this a lot, and I bring it up because I can sense in myself and in other people we're still, we're tired. I'm tired. I'm actually taking tomorrow and Friday off to do have a family activity, and so I'm really looking forward to that as an opportunity for self-care. And there's a lot of opportunities for self-care that we all need to take advantage of. And one of the things I wanted to mention is there will be a wellness webinar offered through the county tomorrow on October 8th on how to become more resilient during difficult times. It's from 2:30 to 3:30 p.m. Apologize for a little error there. Any staff who were involved in responding to or supporting the response to the Creek Fire are strongly encouraged to watch this webinar, and hopefully it's being put on by DIRO, our employee assistance program through the county. And then they will also be offering what's called critical incident debriefing for the first responders. So if you've been a first responder from our department to the Creek Fire and you don't get an invitation to that critical incident debriefing, please contact Helen Herrera, our division manager over facilities and human resources, and she can make sure that you get that invitation to the critical incident debriefing. This is an evidence-based practice. It's not therapy, but it's really an opportunity for people who have a shared experience during a disaster to reflect and discuss and really share those experiences in a structured format, which has really been shown to greatly benefit them in terms of mitigating future physical and emotional problems they might have subsequent to having dealt with such a traumatic experience. And so we really hope all of the first responders in the county take advantage of this opportunity of self-care. And so again, the wellness webinar tomorrow, and then if you've been involved as a first responder, please participate in the critical incident debriefing that's being made available. All right. And then I also just wanted to mention on here the DIRO contact information for any of our staff who feel like they need a little more than what they can provide for their own self-care. I really wanted to go over this in detail because I know I was surprised at all of the services being offered by DIRO. They give information on disaster benefits and other government benefits. They can help people who are trying to rebuild after a disaster. Any of our employees, they give assistance with life, medical, and property insurance claims, replacement of wills and other important legal documents, any mortgage or foreclosure questions, budgeting after a disaster. And so those are really great resources, but they're available to all of us all the time as well. And so there are various resources through the EAP to deal with stress, anxiety, or loss, and they're all listed here. And so those are all available to our staff as well, and I wanted to make sure you were aware of that. All right, the flu vaccine. An email, I've gotten a lot of questions about the comments I made last week about the flu vaccine and the fact that the health officer order around the flu vaccine does mandate that if you work in an area where clinical care is occurring, you are expected to get the flu vaccine. And so I've had all kinds of questions about, does this apply to me? How could I prove that I had the flu vaccine? What if I don't want to get the flu vaccine? When do I have to get the flu vaccine? And so an email will come out from our human resource department with really answers to all of these questions and the details behind them. But rest assured that these questions will be answered through that email, and you'll get more information about how we expect you to comply. I know that some people, like myself, already got the flu vaccine. I was going through my car this morning and I found my daughter's evidence of the flu vaccine, but not mine. So I had that question too. How am I going to prove that I had the flu vaccine? So I know that's a question some of you will have, and so we'll make sure that we answer that question in the email that goes out this afternoon. And so continue to be proud of our teams. We're doing some great work out there. I know all of you are diligently working through COVID and the Creek Fire and remote learning for your kids and teleworking and all of those challenges. Please take care of yourself and your loved ones. Support one another and find ways to separate work from home with your teleworking. Those are all things I'm going to remind you about every week because it's so important. If we're all going to get through this, we're going to have to get through it by taking care of ourselves. If we don't take care of ourselves, we can't care for the people that we're here to serve. And so I'm going to shift to questions now. Someone is asking, is it possible for our IT department to disable the ability for regular staff members to basically reply all? It seems to happen a lot on accident. I will ask that question. Sometimes I have that question, like, can we not reply all to everything? So we'll get an answer to that question. Not sure if we've gotten any text. I know sometimes the chat on the YouTube doesn't work for everyone, and so occasionally we get questions via email to Tina Young, my assistant, and she tries to email me or text me during this process so that I can get your questions. I don't see anything from her. I'm looking to Brian, nothing that he has. So this might be very, very quick, 15 minutes. As usual, if you have a question that comes up after the meeting, I frequently get these questions after the meeting. I'm more than happy to take a question via email to myself or my assistant, Tina Young. And if we're not able to get to your question during the week, get back to you. I'll make sure and bring it up at the next update. So have a great week and a great weekend, and I will see you next week.